During hemodialysis, blood circulates outside the body through an extracorporeal circuit. In certain emergency situations, this blood becomes unsafe for reinfusion. In such cases, dialysis must be terminated immediately without returning the blood to prevent serious or fatal complications. Let us now discuss the three important situations. A blood leak occurs when there is a rupture or defect in the dialyzer membrane, allowing blood to mix with the dialysate. This may be detected by a blood leak alarm or by pink or reddish discoloration of the dialysate. In this situation, blood must not be returned to the patient because it is contaminated with dialysate. Returning such blood can introduce impurities and toxins into the patient's circulation. Therefore, the correct action is to stop dialysis immediately, clamp the blood lines, and manage the patient appropriately without reinfusing the blood. An anaphylactic or dialyzer reaction is an acute hypersensitivity reaction to the extracorporeal circuit. It usually occurs within minutes of starting dialysis and may be caused by membrane incompatibility or sterilizing agents such as ethylene oxide. Patients may develop chest pain, shortness of breath, hypotension, itching, or even cardiac arrest. In this condition, blood must not be returned because it may contain the allergen that triggered the reaction. Returning the blood can worsen the anaphylaxis and become life-threatening. The dialysis must be stopped immediately and emergency treatment initiated. Hemolysis refers to the destruction of red blood cells during hemodialysis. It may be caused by overheated dialysate, hypotonic dialysate, chemical contamination such as chloramine or chlorine, or mechanical issues like kinked blood lines. Clinically, patients may complain of chest or back pain, shortness of breath, and the blood in the tubing may appear cherry red. Blood is not returned in hemolysis for two important reasons. First, hemolyzed blood contains high potassium, which can lead to fatal arrhythmias. Second, if the cause is chemical contamination, the blood may contain toxic substances such as chloramine or chlorine. Therefore, dialysis must be terminated immediately without returning the blood. To summarize, blood should never be returned during blood leak, anaphylactic dialyzer reaction, or hemolysis. The guiding principle is patient safety. Contaminated or dangerous blood must never be reinfused.